Hello and welcome to Bite-Sized MRCP, a manageable way to digest the things that you need to know for your MRCP exam. We are two junior doctors based in the UK who have passed all three parts of MRCP within the last 5 years and want to help you do the same. We are not associated with any MRCP examination organisations, and the materials covered are by no means an exhaustive list of what can come up in your exam, or indeed medical advice. Please refer to your College of Entry or your friendly supervisor for further questions regarding the exam and syllabus. If you like the sound of what you hear today and would like to join us for more bite-sized revision, give us a thumbs up and press the subscribe button. Now, without further ado, let's get into today's topic, which is Escherichia coli or E. coli. E. coli is an important nosocomial infection and colonizes the gastrointestinal tract. Pathogenic E. coli is a major cause of diarrheal illness worldwide. E. coli is a gram-negative, facultative, anaerobic, rod-shaped bacterium. Most strains are harmless and part of the normal gut flora. Others are pathogenic, causing both gastrointestinal and extraintestinal diseases. It is responsible for numerous outbreaks worldwide, varying in severity from mild gastroenteritis to life-threatening hemolytic uremic syndrome. There are several subtypes of E. coli, some of which are listed here. The most famous one possibly is enterohemorrhagic E. coli, or EHEC, notably the 0157H7 strain. Pathogenicity of E. coli involves toxin production, adhesion to intestinal cells, and invasion. There are several clinical manifestations of E. coli depending on the organ involvement. Gastrointestinal disease causes a mild diarrhea all the way through to severe abdominal cramps and bloody diarrhea, particularly with EHEC. Extraintestinal disease can cause urinary tract infections, which are fairly common, neonatal meningitis, and in rare cases septicemia. High-risk populations include the very young, the elderly, and immunocompromised who can become quite ill very quickly from infection with E. coli. The management of E. coli is guided by antimicrobial susceptibilities and local empirical guidelines, although in the case of E. coli 0157, rehydration is key for hemolytic uremic syndrome. Preventative measures include proper food handling, cooking, and hygiene practices. So let's try a question. A 55-year-old man presents to the emergency department with severe abdominal cramps, bloody diarrhea, and a low-grade fever. He reports eating a hamburger at a local restaurant 2 days previous to the onset of symptoms. A stool sample is positive for E. coli. Which of the following strains of E. coli is most likely responsible for his symptoms? So here we have the 5 different types we spoke about before: E-TEC, E-PEC, EIEC, EHEC, and EAEC. The most likely cause here is EHEC, particularly because of its association with undercooked beef, and in this case the patient has eaten a hamburger recently, and that is the most likely source of his infection. Thank you for listening to this episode of Bite-Sized MRCP. If you like what you've heard today, give us a thumbs up and hit the like and subscribe button below to make sure you don't miss our next episode. Let us know in the comments which topics you would like to hear in future. See you in our next episode.